Okay, hello, my name is Paul Miller. I'm the chair of AWP NHS Trust, and like I did it after the last board meeting, I'm going to give you a quick update to the board meeting we've just had on today, 14th of May, 2025. So a very long and varied agenda, but I'm just going to pick out some key issues. Firstly, we made a difficult decision around the ACER drug and alcohol inpatient unit. As I said, very difficult decision. We've made a decision to close it, and that's been recommended through a long and comprehensive report that built on a number of months, 3 months worth of engagement and lots of discussions and lots of meetings. We acknowledge there's been a shift to a more community-based model for drug and alcohol detoxification, and this has led to a significant reduction in the unit's sort of number of patients going through the unit. We can confirm that with the closure and before the closure, all patients currently receiving the treatment there will have their treatment concluded. And we'd also like to thank all the staff and who've worked in the unit for all of their long dedication and service, as well as all the people who've been involved in the engagement exercise. There's a lot of views expressed, a lot of commitment, a lot of passion. And as I said, it's been a difficult decision, but we've got to where we've got to, and we feel we've actually made a sound decision. Also recognising that there is a service being provided going forward in Bristol, and we need to work with the partners who are providing that service. Secondly, I'd like to raise up a report we received from the Freedom to Speak Up Guardian, which summarised the role and importance of raising concerns and speaking up. I can't emphasise enough how important it is that we support freedom to speak up. There is no place in our organisation for any pockets or areas of the trust where we actually don't have excellent, great services. So what we need to do is focus on, if we have concerns, if we have problems we need to raise, contact the Freedom to Speak Up Guardian and their service and the people who promote the work. This is really vital, and I trust and I emphasise on behalf of the board, we will support people every step of the journey on that. And therefore, if in doubt, please raise it. We need to learn, we need to address issues, we need to improve. Thirdly, we had a fantastic patient story from Edna. She told a story about how she was a carer and became a carer for her husband, John, when he was diagnosed with dementia in his early 60s. Edna talked about the challenges of being a carer and how she's used her experiences to support other people alongside other volunteers. As part of that volunteering role, Edna supports a wellbeing friends group in South Gloucester, which is supported by AWP and which provides immeasurably important support to both dementia service users and their carers. Edna's story was full of humanity, passion, humour. There were moments that made you gulp and go, gosh, that's what bravery looks like. But my abiding sort of memory from it is that she spoke from the heart and moved the board, and we're a better board for hearing that story. So thanks to Edna. And also it just emphasises the importance of not having any stigma around any of the services that we have. It's really important, and people need to be able to talk about things and not be embarrassed. So thank you for Edna, and thank you for all the people who work in this area. The final thing just to highlight is finance. We have achieved our financial plan this year, which is great, and that's down to a huge amount of work that's been supported by all members of staff in this organisation in AWP. Reducing agency and bank, it's been fantastic. We've got high levels of permanent staff in place, which is great. We've taken the work forward to the capital programme to improve the estate. So it's a great result financially. We do need, however, to continue doing this going forward. And unfortunately, the way the NHS is, 1 year then rolls into the next. So therefore the challenges become real again. But with your continued support, we'll continue to deliver a good financial result. So those are the 4 key areas. Hopefully that's been a useful feedback. If you're interested at all in any of the board meetings, our next board meeting is the 23rd of July at Fountain Way in Wiltshire. And you can also join online and view the board meeting through Teams. So thank you for listening, and have a great rest of the week.